Okay, so don't forget to fill out the course evaluations. The deadline is December 21st. We're always looking for presenters on topics for seminars. So if any student has an invited speaker that will want to invite, let us know.
So I would like to thank you again for keeping your cameras active. This is not a punishment. So if you have to do something, so you can take a break, come back. You don't have to be permanently here. Just to explain that one of the reasons is that we received complaints from some of our presenters that some of the students who had their name that they when they ask questions, they were not available. So that's why we took this step. So it doesn't mean that you must every week, but we appreciate you putting the camera on. So one of the things we wanted to recognize is students who have really been participating, and I would like to, there was exceptional initiative by proactively asking questions, and we want to recognize Mashid. Mashid, are you here?
I don't think she's here yet. I don't think she's here yet.
Yeah, so I'd like to congratulate Mashid. She has consistently been very proactive, asking questions all throughout, and so would really want Mashid, if they can, you can send us your photo.
We have it. We have it. We have it.
Mashid,
me?
can you just
I'm muted. Can you hear me?
Yeah, we can hear you now.
Yeah, thanks for the award. And actually, I'm so curious about every topic, and that's why I appreciate these seminars and these weekly meetings, and I appreciate this award and this appreciation. Thank you so much.
Thank you very much, Mashid. So this comes from our department, and the department were very unanimous and really appreciating your contribution. Please send us your photo, and we'll enshrine you on our website, so you'll be there forever. And the title and your name, so that and we'll also send you a certificate. So things like this are important when you're applying for something, job or position, the recognition, and the fact that you can be able to back it up by being on the website. So I think we're gonna start with a student, Muskan, our president. Can you introduce our first speaker? So, okay, the other thing is that before we go to that, is that every student who presents, we are going to include their name and their photo on our website. So that's what we're going to be doing, and we'll go back to the students who presented, and we are going to put their titles, and please send the photos to Laura, and we are going to put them on our website. So thank you everyone for participating, and thank you for the students for their very positive response.
It's just to let you know, if you don't send me the picture, I'm gonna use the one that it's on your McGill card. So it's better to send me something that you like.
Muskan.
Yes, thank you. So hello everyone, good afternoon. Welcome to IRR, an experimental surgery seminar series. So today we have one student presenter, and a poll will appear at the end of the presentation. Please fill it up for us. The student presenter is Zanib Nafees. She is in 5th year of a PhD in surgical and scientific innovation, and she is supervised by Dr. Quaiattini. Her current research delves into patient-reported experience measures, particularly focusing on children, aiming to enhance their hospital journey by giving them voice. Her today's topic of presentation is adaptation, translation, and validation of a patient-reported experience measure for children and young adults for the Canadian context. Over to you, Zanib.
Hello, everyone. Just to make sure you guys are able to see my screen.
Yes.
Okay, perfect. Great. Okay, great. So good afternoon, everyone. My name is Zanib Nafees, and I'm a PhD student at McGill University in the Commissaire Lab. Before I start, let's consider a situation. Picture a small child, full of excitement, walking into a hospital, holding on to her beloved stuffed animal while she makes her way through busy hallways surrounded by strangers. Even though she might feel scared and unsure, her voice holds great influence on how she experiences the hospital. Let us delve into why children's voices are important and how we can support their involvement in the hospital. Patient-centered care is about prioritizing patients and tailoring treatments to fit their specific needs and social context. This matters because it builds trust and improves outcomes. Patient experience refers to how patients feel as they go through their healthcare journey. To measure this, we use tools like patient-reported experience measures, PREMs, that allow patients to share their thoughts directly and contribute to making healthcare even better. PREMs gather information on patients' views of their experience while they're receiving care. They indicate the quality of patient care received by a patient, although they do not measure it directly. PREMs are most commonly in the form of questionnaires. In this example, responses are scored on a 5-point scale. The options to grade the experience start with poor. The other options are fair, good, very good, and excellent. In contrast to patient-reported outcome measures, PREMs do not look at the outcomes of care, but the impact of the process of the care on the patient's experience. For example, the communication and timeliness of assistance. They differ from satisfaction surveys by reporting objective patient experiences, removing the ability to report subjective views. Les mesures de l'expérience rapportées par le patient, PREM, diffèrent des évaluations de satisfaction. Les notes de satisfaction évaluent les attentes, tandis que les PREM saisissent ce qui s'est passé pendant un épisode de soins et comment cela s'est passé. Consider these questions. Did you like the hospital appointment system? And were you able to use the clinic's phone number on the hospital website to book a follow-up appointment with the nurse after the surgery? The satisfaction question assesses the hospital appointment system's meeting of expectations, while the experience question delves into the process details of scheduling a post-op appointment, covering what and how aspects. Les PREM sont précieuses, efficaces et pratiques. Ils s'avèrent utiles pour les rapports publics, l'étalonnage institutionnel, le plan de santé et l'amélioration de l'expérience des patients. While PREMs are valuable, complexities arise in modeling, content creation, testing, and resource availability. In pediatrics, involving children and families is vital to capture essential care aspects. The problem is that there is no PREM being used at the Montreal Children's Hospital. And our lab has done a scoping review where the conclusion is that PREMs are not yet in use, being typically substituted by satisfaction surveys. Actuellement, il existe peu de PREM pour les enfants. En particulier, l'instrument gauche du Great Ormond Street Hospital, développé avec des enfants et pour des enfants, se concentre sur les soins, l'environnement hospitalier, la communication et l'expérience ambulatoire. L'instrument gauche sera désigné comme l'instrument PREM UK dans les prochaines diapositives. In response to pediatric care complexities, lack of relevant PREMs, and cultural sensitivity needs, we adopted, translated, and linguistically validated the PREM UK instrument for Montreal Children's Hospital. Our aims encompassed modifying the PREM-UK for MCHS context, precise translation, and validating scores across English and French adaptations. L'étude a utilisé un modèle de recherche qualitative en 3 phases, visant à appliquer les résultats à divers contextes canadiens, y compris le children's. We used established PREM-UK tools for ages 8 to 11, 12 to 13, and 14 to 16. Phase validation form, QQ10, measured validity, feasibility, and utility adapted for children's assessment. Participants were recruited from a pediatric surgery clinic at the MCH. Informed consent was obtained with compensation given. Parent or caregiver presence was ensured during instrument review, and sessions were held mostly on Zoom, but occasionally in person, and were recorded and transcribed. Demographic data, including age, sex, and languages, were collected, and PREM questions were evaluated for meaning, clarity, and relevance. Des enfants âgés de 8 à 16 ans, sans handicap cognitif, parlant couramment l'anglais ou le français, ont été inclus. Les sessions hebdomadaires comptaient 2 à 3 participants par groupe d'âge et duraient environ 30 minutes, avec le soutien des parents ou des soignants. Le projet comprenait 3 phases. L'adaptation de l'instrument PREM-UK aux enfants anglophones, sa traduction en français avec des ajustements itératifs et sa validation linguistique. Le processus comprenait des tests de réflexion à haute voix, think aloud testing, des tests cognitifs, l'intégration du feedback et la validation bilingue pour améliorer la précision et l'alignement culturel. Des stratégies telles que les distracteurs intentionnels et l'alternance de l'ordre des instruments ont été employés pour contrer les biais lors de l'évaluation. In the realm of children completing patient-reported experience measures, PREMs, think aloud testing and cognitive testing emerge as important tools for gaining insights into their perspectives. Think aloud testing prompts children to vocalize their thoughts and feelings while engaging with the PREMs, offering a real-time glimpse into their understanding and emotional responses. Meanwhile, cognitive testing evaluates the cognitive abilities of children in the context of responding to the measures, shedding light on factors such as comprehension, memory, and problem-solving skills. These methodologies, tailored to the unique needs of young patients, contribute to a deeper understanding of children's experiences and challenges in expressing their healthcare encounters, ultimately informing the refinement of PREMs for pediatric population. Phase 1 involved 15 Think Aloud and 14 cognitive testing sessions. A total of 29 children participated in both sessions, 16 females and 13 males. Feedback led to consensus-driven question removal, and cognitive testing revealed notable item changes across age groups. À la phase 2, 12 enfants, 8 filles, 4 garçons ont participé, apportant une contribution précieuse aux modifications. Les tests cognitifs ont révélé des changements, principalement chez les 14 à 16 ans. In phase 3, 14 of the 29 approached patients participated, completing both English and French PREM versions and the phase validation form. Intra-rater reliability was good for the 8 to 11 year group, moderate for 12 to 13 year, and good for 14 to 16 year. Dans le formulaire de validation, le retour d'informations qualitatives était limité, mais les questions d'évaluation ont donné lieu à un score moyen de 2,29 sur 4 pour la valeur et à un score moyen de 1,46 sur 4 pour la charge. La figure ici démontre la distribution de la fréquence des scores pour chaque question du formulaire de validation. Les scores de valeur indiquent que l'instrument est facile à remplir, agréable et pertinent. Les scores de charge sont démontrés par l'évaluation de l'instrument comme étant trop long et trop compliqué. Et l'étude s'est achevée en 9 mois. In summary, 55 children participated in our study in which we adapted, translated, and linguistically validated the first Canadian PREM. Modified for a Canadian context, the process proved to be effective and cost-efficient. Phase 1 ensured a faithful reflection of the children's perspectives, while Phase 2 focused on the fidelity and coherence of translation. Finally, Phase 3 demonstrated effectiveness in capturing the experiences of children. Les limites de l'étude comprennent une généralisation limitée du fait de la focalisation sur un seul établissement pédiatrique qui est un échantillon de petit a en raison des difficultés de recrutement, en particulier au cours des phases 2 et 3. Le traitement de réponses contradictoires de la part des enfants a posé des difficultés pour saisir les diverses perspectives et l'absence de commentaires qualitatifs sur le formulaire de validation a limité la compréhension globale des perspectives. For the past 3 months, I joined the Canadian Accelerator Lab to Market, partnered with MyTax, to interview children as co-researchers, engage stakeholders, and create a plan to standardize PREM across Canada. Our plan is to implement a national database which will assess quality of life measures and the outcomes and experiences of children with neonatal conditions longitudinally across their lifespan. I interviewed 70 different stakeholders, including 22 patients, 17 researchers, 10 doctors, and 9 parents. And here are some experts from their interviews. All emphasize how important it is to listen to children and involve them in decision-making regarding their healthcare. En conclusion, notre étude visait à améliorer le soin centré sur le patient, pour le patient en chirurgie pédiatrique en créant un PREM canadien. En donnant aux enfants les moyens de partager leur expérience, nous avons obtenu des informations qui permettront d'orienter les futures initiatives en matière de soins de santé. Ces résultats permettront de personnaliser les services, de répondre aux besoins des jeunes patients et de créer un environnement favorable tout en atteignant les inquiétudes. I want to thank my supervisor, Dr. Dan Pinero, and the Commissaire Lab, and a special thanks to Dr. Julia for her invaluable support and guidance in my research presentation and manuscript writing. I'm grateful for their contribution. Please feel free to ask any questions. Thank you very much.
Thank you, Zanab, for the great presentation. Really loved it. So are there any questions? Yes, Razan.
Thank you, Zainab, for your interesting presentation. My first question, you mentioned that the patient, I think daycare, surgical patient in daycare, which group you choose your patient? From where, which areas?
Yeah, so...
And do you think about expanding that to, because you have a lot of patient experiences in clinics, in radiology department, and as well surgical department, and you validate the NHS UK Foundation PREM. I wanted to ask you about the ethical issues. Did you contact them about using modification modify their PREM? And do you think about increasing your sample size, because we have a lot of patients in Montreal General Hospital? Thank you.
Thank you so much, Razan, for your excellent questions. To answer your first question, I included children ages 8 to 16 years of age. And we divided it into 3 categories, so 8 to 11, 12 to 13, and 14 to 16. And this was based on the second question. To answer your second question, we did an collaboration with the NHS, the Great Ormond Street Hospital's principal investigator, Dr. Joe Ray, and they're the ones who created this patient report experience measure, and we basically used it for the Montreal Children's context. And for the third question, we definitely need to increase the sample size. 55 is still good for the 9-month period. I was going to clinic almost every day and recruiting participants. And yeah, and then for future initiative, definitely we can we have goals to increase the sample size, and also we like based on the lab to market results, we want to include different hospitals and to standardize the PREM across Canada.
Thank you.
So Zainab, there are 2 questions in the chat. So one question is from Mashid. The question is, what was the difficulties you experienced during your journey? Yeah, and yeah, so I'll go one question at a time.
Okay, perfect. Yeah. Thank you, Mashid, for your question. Yeah, the difficulty definitely was, as I mentioned, for the limitations, there was, small sample size. And we definitely had limited generalizability, so we only focused on one hospital. And for the future initiative, we do plan on having to include Saint Justin and other hospitals in Montreal. Collaborate with Alberta's Sick Children Hospital. So yeah, we do want to. We have plans of standardizing it, and so we do need to collaborate with other hospitals. And then that's just going to help us increase our sample size. And then in terms of the recruitment challenges, there were some days that I had no participants, some weeks I had no patients, so there was that. And there were some conflicting responses in between groups, particularly in 12 to 13 year age group. Some of them would love the some sections of the instrument, and some of them wouldn't like it at all. And so we had to find a middle spot and do the agreement, right? Like the percentage of agreement, and then put the questions in our version based on that. And for the phase validation form, a lot of patients missed out on the qualitative portion. And so a lot of them didn't give their feedback. And I think that would have been very instrumental in, creating a more of a, giving depth to the phase validation form. So those would be most of the limitations.
Thank you, Zainab.
So thank you. So the other question is, do you anticipate any challenges with expansion of the project across Canada? That is, if some of your results, if some of your results may not be generalized beyond the Quebec experience?
Yeah, so I mean, the main goal, I think we shouldn't forget, is to, gather patient experience, to gather children's experiences, and children are really keen on giving their experience about their hospital. So with that in mind, I think there obviously we do anticipate challenges, and some of them are, we can foresee those in terms of recruitment. And I think that would be, but I think when we collaborate with other hospitals and give our vision, I think it's something that is tangible and doable to be standardized across Canada. And yeah, and this just gets to show that there was a need, and it has been met.
Thank you, Zainab, for the question. Answer. Sorry. And if there are any more questions, they are more than welcome. So there is one more. So it's from Cherry Net. Great talk. If I understand correctly, you mentioned that you were provided compensation for participants. How do you come up with ethical considerations?
Thank you for the question. I think that's a good question. The reason why we decided to give compensation to the children, and it was in the form of gift cards, and so like it wasn't like tangible money. We gave like Indigo or Cineplex gift cards for their participation, and I think they really enjoyed that, and we included that in our informed consent as well before they signed it, so they had that option, that they will be compensated in a form of gift card.
That's great. Okay, so thank you, Zainab, for a great presentation. Everybody really enjoyed, I think, and I loved it as well. Thank you so much.
Thank you so much.
Yes, and I would like to introduce Dr. Foxon Mole for the further seminar. Thank you.
So thank you very much, Muskan. Thank you, Zainab, for that wonderful presentation. And I would like to also thank your supervisor, Dr. Poinero, for all the wonderful students that have been given us access to what is done in the lab. So we really thank their contribution to the seminar. So the next presentation, actually it was born out of something we took for granted, that our students, if you tell them find this article, they will find it. And so so we were a little bit surprised to find that this can be a challenge. And so every time we say, can you find this article? It's a PubMed. If it's not in PubMed, oh, can't find it. So we were a little bit surprised. So Miss Andrea Quaiattini is going to talk to us and give us this wonderful information. Her role as an assistant librarian at the Schulich Library for Physical Sciences, Life Sciences and Engineering, as well as her association with the Institute of Health Sciences, Education, positions her as a key resource in the academic and research community. So her responsibilities and expertise include as a liaison library for multiple departments, so a lot of departments, as a support for postgraduate medical education and Indigenous health, instruction and guidance. So it gives a lot of valuable instruction and guidance as she would do to us today. Research support for knowledge synthesis projects, as well as expertise in health sciences education. So basically her role at the library and her association with the Institute of Health Sciences Education highlight as a valuable asset in supporting medical and health sciences education and research, particularly through her skills in information literacy, research support, and academic collaboration. So thank you very much for taking your time to talk to us. So
I'm happy to. Yeah, thanks for having me. It's nice to see some familiar faces here. It's lovely to see. So hello to the people I know and hello to people I will happily meet with in the future. Yeah, so I am Andrea Quaiattini. It also rhymes with tortellini, if that helps you remember me. Yes, I am Italian, so there you go. Yeah, so we're gonna, just to confirm how much time I have, do I have till 2:30? I don't want to run over time. I wasn't too sure. Till 2:30?
Yes.
Okay, good to know. Okie dokie. So I might bounce through a few more things than a bit more quickly today than I had intended. That is okay. You will have my email. I'm happy to meet with you guys individually. This is more to give you kind of a base understanding of searching the surgical literature so that when you meet with me, we can maybe sort of cruise through some of this, not beginner, because it's not beginner, but some of this more starter material to sort of advance you up a bit more so that when we meet together, we can kind of get started and move into some maybe a bit more advanced stuff and get really more into the nitty-gritty details. So I will share my screen. Really, I'm going to be doing a lot of live demoing. So if you would like to type along with me, that is fine. If you'd like to watch, that's fine too. I will have some slides. I'll share those at the end. The slides will better reflect ultimately what we wind up searching. So that's why I'm not just working off the slides today. But let me share my screen and we will get this party started. Also, as you can see, I run a very informal Zoom room. So if you have questions, pop them in the chat, raise your hand, pipe up, whatever you feel most comfortable doing. And there we go. Okie dokie. Are you seeing? Yeah, you are seeing slides. Okay, we're just gonna do that. Awesome. Okay, so there's me, there's my email, probably the most important slide. There we are. So learning outcomes. So by the end of the workshop today, you'll be able to identify appropriate information sources to answer your research question, how to translate a research question into a search query using concepts, mesh terms, keywords, and Boolean operators. We'll talk about some of the advanced search functionalities in Medline to improve your search. And we'll also talk about how to execute a simple search in Scopus and use the analyze results function to really mine those results. I find that, especially if you're new to a topic, this is actually a great way to start coming up with ideas and kind of getting a nice scope of the research content and sort of the research environment and what's out there. Because really, when you're searching, this is not, especially for your projects, you're really not just searching for 5 papers and then you're done. You're really, now that you're in grad school, you're really wanting to situate your research questions within that whole broader literature body. So that means you're probably going to have to execute multiple searches, and that is okay. That's actually part of the process. You might even have to search multiple databases, which is also okay and part of the process. So it's not just throwing a couple things into Google Scholar, which has its place, and that is okay. My 2 cents on Google Scholar, it's a fine place to start. It's just not a fine place to end. You really, it's a great place. You know, I use it because I'm not a doctor and I'm not a surgeon. And this is not my, you know, my background is in military history if we're going for an interesting career change. So, you know, I'm not as familiar with this literature, so it's often a place where I start for my searches. But then I take what I learned from Google Scholar or from a really simple Scopus search, and I take that information and then I'll move it into something more substantive like PubMed or Medline. So really, this is why we're searching in multiple places. Sorry, just checking the chat. So some ideas of where to search. There are lots of places to search. I'm going to be focusing on Medline today. In terms of content, it's basically the same thing as PubMed. It just has an interface that allows for more complex searching. If you are more comfortable searching PubMed, the ideas that I'm going to be talking about, specifically how to break down a search into concepts, how to use mesh terms, those are all the same. It's just once we get into some of the more advanced search functionality, you don't have access to those in PubMed, but the content is the same. Another database that I use quite regularly is Embase. There's a lot of overlap with Medline. It has more European content, and if you're interested in drug information, has a lot more drug information. The nice thing about Medline and why I'm teaching you Medline is because it uses the same interface as Embase. So there are some minor differences, and unfortunately we don't have a chance to get into those today, but basically, broadly speaking, once you learn how to search either Medline or Embase, you can take a lot of those skills and actually just transfer the search right into the other database. Where the differences lie are in mesh terms or that controlled vocabulary. If you've never heard of mesh terms yet, that's okay. I'll talk about those in a second. Couple of other places you might want to search: CINAHL for nursing and allied health information. Scopus, I've already talked about. It's a nursing and big interdisciplinary database with a STEM focus. So if you are working on a topic, something like haptics, which we might be searching today, quelle surprise, you might want to search in Scopus to get some of the engineering computer science literature. So this is what I mean where, going back to my previous slide, you might need to get different perspectives on a topic. You know, it's not just how might people view your subject just through sort of a surgical medical lens. You might want to understand how nurses interact with this idea. If it's technology, how might it have been developed? How are the computer scientists and the engineers involved? Stuff like that. And then finally, ERIC. I bring it up for folks that are maybe in the surgical education stream. It's an education database. You only need to search keywords, but that would be, I'd be surprised if you need to search for that. But again, that's something we can talk about. Yeah, any questions about where to search? There's obviously lots of other places, but those are kind of the big ones that I tend to use in when I'm searching in surgery. Okay. All right. All right, next slide. So translating a research question into a search query. So when we are using databases, we really can't take our research question and just plonk it in like we would with Google or Google Scholar. You really have to think about a couple of things. You have to think about, with your research question, where might that information live? It may not live in a database, and that is okay. You might need to go to I don't know, an organization's website. You may need to look at policy documents. So something that's that kind of information, material that's published outside of sort of traditional academic publishing, so journals, books, textbooks, etc. That's called gray literature. So you might need to look and read the gray literature, and that's totally fine. But just keep in mind that is going to impact how you search, regardless of where you go. Again, your Google Scholar search is not going to be the same thing as a Medline search, is not going to be the same thing as even a Scopus search. So once you've figured out where you need to go with your information or where you need to search, you need to break apart your research question into concepts. So the key ideas, you just can't put a full sentence into PubMed or Medline or anything. You'll get an error message. So identify the concepts, and then we need to operationalize those concepts. So in a database like Medline, these are operationalized through controlled vocabulary, mesh terms, keywords and their synonyms, and then we use our Boolean operators to combine and everything all together. Identifying concepts can be a bit tricky. So if you're familiar with PICO, that might help you identify concepts. That being said, if your question does not fit a PICO format, that is okay. I am not a fan of PICO. I have yet to meet actually a librarian that really likes PICO. We find sometimes people get very hung up on trying to smush a research question into a PICO format. And often that's not really feasible. PICO is it's a very clear intervention kind of question. So if you have an intervention with an outcome and a population, it makes perfect sense. A lot of research questions don't actually meet that format. So if PICO helps you think about concepts, go ahead and use it, but please do not twist yourselves in knots trying to create a PICO question out of the research question you have. Identify those fundamental things or those fundamental elements that you are looking for as part of your question. And those might be very vague things like attitudes, perceptions, motivations, and outcomes. These can be very hard to search for. So you either have to think very carefully about the synonyms, or you don't even search for them at all. Because just because you've identified as a concept doesn't mean you will or can search for it. So an example would be, let's say you're searching for, you're looking for the impact of drug X on disease Y. Well, if you're thinking, if the outcomes that you're looking for are, I don't know, broadly improved quality of life, whatever that means, and reduced hospital stay. Okay, fantastic. I mean, I know those are kind of ludicrous outcomes, but broad example. So if we take those outcomes, we can search for them. But what if one of the other outcomes is that this drug also turns your hair purple? Well, if you are only searching for, improved quality of life and reduced hospital stay, you're not going to see the outcomes that say the articles that talk about, yeah, but this drug also turned our patient's hair purple, and they weren't particularly pleased about this. So this is why we need to think about, when we've identified our concepts, is it something that we're going to search for, or is it something we're going to screen for? And that's, and the nice thing about searching is you can play around with this idea. you can try a version of your search where you include the outcomes, or if you're not sure whether this is something you should screen for or something you should read for, try and search for it and see what comes up. And again, this is something that if you're not sure, we can always talk about. I tend to, with what I call wibbly wobbly topics, like attitudes, perceptions, motivations, stuff like that, I generally don't search for. That would be something I would read for. Outcomes, I can argue either way. If you have a very specific outcome you're looking for, I would probably search for that. But if you're not sure about the outcomes, then I would read for them. Does this idea make sense? Because this can be a little bit of a mind, got to twist your brain around it. Does that make sense? I see a few nods, so yeah, okay. Thanks. So we are going to work off of a very broad topic, but this is to show you really, the reason I've chose such a broad topic is not necessarily for the content of the studies, but more that it shows the basics of searching, and it also helps me to show some of the advanced search functionality that the database that Medline uses. So we're going to be talking about the use of haptics in neurosurgical procedures. I mean, this is very big. So really, if if you were researching this topic, I would be surprised if you went so big as something like all neurosurgical procedures. That's pretty big, but you never know. Haptics is a relatively, recent-ish kind of thing. So we may need to, maybe you're interested in seeing how haptics has been used across all these different procedures. Maybe you're just interested in one procedure. So we can play around with our search in this kind of way. So we'll work off of this. Now, if we're going to think about our concepts, I mean, this is a pretty straightforward one. Our concepts are haptics and neurosurgical procedures. So I won't make you jump through that hoop and ask you what the concepts are. But a good search is a combination of mesh and keywords. So what is mesh? I keep talking about these. Actually, does anybody out there heard of mesh, want to give me a quick definition, their understanding of mesh terms? Or is this a brand new term for you? If you want to put your hand up. Yeah.
Mesh is basically a structured vocabulary giving based around concepts or broad headings. Yeah,
exactly. Yeah. Yep. Yeah. So, and it's organized in a hierarchical structure. Yeah. And so that's fantastic. So mesh stands for medical subject heading. So basically there are so many ways, as an example, how many different ways can we say cancer? So many ways. So what mesh or controlled vocabulary do is it basically lumps these terms together under a predefined term. It's defined by the National Library of Medicine. And that way it's basically, as we see by my next slide, standardized hashtags, if we even use hashtags anymore. I don't know. I'm an old lady. I still know what hashtags are. So hopefully all you lovely young people know what hashtags are. And if we don't, please tell me that this example makes no more sense anymore. But this is how I've taught mesh for a long time, is that they're like hashtags. So if we have an article, it is tagged with a mesh term with the hashtag, but that hashtag has been standardized by using a word or phrase and a definition. And again, it's organized in this hierarchical structure to show the relationality between terms. So different characteristics of mesh. So once we go into the database, you'll be able to see these. So a scope note, this is super important. It provides you the definition of the mesh term. You really do want to read this just because you want to make sure that how the folks at the National Library of Medicine who are defining that mesh term, you want to make sure that how they are defining a term is the same way that you are defining the term. Now, In some cases, sometimes we kind of have to hold our nose and be like, well, that's not quite what I mean, but it's close enough, so I guess I have to go with it. Or in some cases, you're like, that is not at all what I'm looking for. I'm really looking for something else. Then if there's not a relevant mesh term, you don't need to use it. Something else is called exploding the mesh term. So remember how I talked about meshes organized in that hierarchical tree structure? By exploding the mesh term, it's saying, well, if this is kind of my, sorry, put my hand where you can see it. If this is kind of like my anchor or my home concept, so let's say it's, breast neoplasms, or breast neoplasms is the mesh term for breast cancer. But underneath breast cancer, there are different kinds of breast cancer. So by exploding the mesh term, we're going to include breast cancer, that's main one, and everything underneath it, because really they're all kind of connected or related to each other. So that's called exploding. Another way of thinking about it is basically ORing the home mesh term or the anchor mesh term with all the other terms underneath it. So if Boolean operators make a bit more sense to you, we're just doing a big OR with our mesh terms. Once I'll show you this in the database, it'll make a bit more sense. So that's a mesh term. And now we move on to keywords. So a good search is a combination of mesh terms and keywords. So when we are searching, sorry, let me just check the chat. Boink. So Marzi did that. Let me finish my keywords and then I'll check in with you to make sure I answered your question. And then Marianne, that's a great question. The mesh terms are actually applied to, let me move this to my other screen. There we go. Yeah, so mesh terms are actually applied to your article. It was done by people up until about 3 years ago. There were actually people at the National Library of Medicine, they're indexers, and they would basically read your article and they would go through their big books of mesh terms and go tick, 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 and apply the terms. Now it's done by artificial intelligence thing, and it sometimes does an okay job and sometimes it doesn't. So you do not have to worry about the mesh terms. You need to worry about keywords. So your author supplied keywords. Those are, think carefully about those. So that's your author supplied keywords is something that we can search. So that's where you want to use those, but you don't have to worry about the mesh terms. Does that answer your question?
Yes, thank you.
Awesome, great. So keywords. Let me just bring my mouse back over other way. There we go. So when we are searching, so let me bring up something here. Ta-da. So this is called an article record. So this is what, when we are searching a database, this is what we are searching. We are never searching the full text of an article. It's not possible. Basically, what the information is on this page, this is what we can search for. So in Medline, everything here down the left-hand side is called a field. So the title is a field. The abstract is a field. Keyword heading, which is author supplied keyword, that is a field. So this is when we are searching our keywords. These are the most common ones that we're searching is title, abstract, and author supplied keywords. Those are the most common fields that we can search for. We can search in other fields, that's totally fine, but those are the big ones. So Marzi, does that help answer your question, the difference between Medline or keywords and mesh terms? Awesome, great. Sorry, I'm just trying to bring back something here. There we go. Okie dokie. So why do we have to use both? It's so much work. It is. However, it does help you with your searching. So mesh helps so that you don't have to think about every possible synonym for a concept, and mesh terms are allocated based on the full text of an article. So when an article is indexed, it is actually read by, the whole thing is read by the AI, by the NLM's AI indexer. So there may be stuff in the full text of the article that is not represented in the title or the abstract or the author supplied keywords. But if it's really important, it's going to get pulled out as part of the AI indexing. It's going to get pulled out and tagged with that mesh term. So that's how mesh terms give us insight into the full text of an article. Again, the keywords, we're stuck with title and abstract. That being said, it takes time for mesh terms to be added, so we have to use keywords to capture the most recent publications. So as an example here, so this article, it is very, well, it's not super new, but the only reason this article does not have an abstract, fair enough, it's a letter, but it doesn't have an abstract. So the only reason when I did a search, I am only finding this article because it is indexed with mesh terms. So those subject headings. So mesh is a field all by itself. Now this article here, we can see here, it doesn't have any subject headings applied to it. And this is, yeah, and this is what I mean, where it can take, they're not quite this bad. I'm surprised this one doesn't have mesh terms applied to it yet, but it doesn't. So the only reason we are finding this article in our search is because we are searching for keywords. So this is why we need to do both. So we've searched the title, keyword heading, which is author supplied keyword, and the abstract. So here we've got our neurosurgical, which is one of our concepts. And here we've got haptics, force feedback, another, our other concept. So how might we put this into a database like Medline? So, sorry, any questions about what I've talked about so far, mesh and keywords?
Yes.
Yeah, of course. Yeah.
Thank you for this, always your
Yes.
interesting presentation.
Nice to see you, Razan. Hi.
Thank you. Hi. I would like to ask you if I'm searching, I need to clarify my example to understand exactly, because now if you read the articles, you will see keyword after below the abstract, but no more mesh. But this help us to in our search, like if I want to search about epileptic post like brain tumor, neurosurgery. What you mean, mesh? I should clarify. This is glioma or meningioma, or how can I go down? I should specify the tumor, because this is a brain tumor hole punch. I should specify.
Yes. Yeah. So, sorry, go ahead. Sorry, I'll let you finish. Apologies.
This is what you meant in mesh.
Yeah, in mesh. So there is a specific mesh term for brain neoplasm, so brain cancer. So that would be a mesh term that you would search for. And you actually might even want to search for the specific type of brain tumor. So I'll show you when I go into my search what this might look like for you.
Thank you.
But yeah, does that answer your question? It's a good question. Okay, good. Okie dokie. Right. So fastest way to get into Medline from the library's homepage, if we go under Health and Biological Sciences here on the right, click, and under Key Resources, Medline on Ovid. So Ovid is the platform. We could think of platforms if we want to use an analogy like with car manufacturers. Ovid is like Ford or Honda or Toyota. And underneath those brands or that sort of platform, we have different databases or different types of cars. So, now I have to think of cars. Okay. So if we're thinking of, let's say Honda, we can have a Civic or a CRV. Sure. I think that's a car that Honda makes. You get the idea. So that's under sort of the Honda. The Honda is the platform or the brand. Ovid is the platform. So that's kind of the brand. And underneath Ovid, there are lots of different databases. Medline is one, Embase is one, PsycInfo is one, which is a psychiatry based database. So that's the nice thing about once you kind of learn how to search in one of these databases, you can actually take a lot of these ideas and transfer it to other databases. Yeah. So let's start off with So searching, sorry to be the slight bearer of bad news, but searching for surgery is more complicated than most searches. So you guys really do get kind of rocketed up into more advanced searching right away. Because we have to search for the surgery idea in multiple, sort of through multiple ways. Sorry, I'm just trying to bring something up on my other screen. I did the search before, so I could remember what I was doing. So there we go. All righty. So one of the, here's my mouse. There we go. Okay. So one of the main ways that we have to search is through the procedures itself. So we're talking about, again, haptics in neurosurgical procedures. So the broadest way, so if we just type in surgical procedures, so what we're going to do, so we're going to search in here, and what the database is going to do, it's going to try and find whatever you put into this box here. It's going to try and map that term to a subject heading or to a mesh term. So I've put in surgical procedures and I'm going to hit search. Well, what the database is doing is it says, okay, well, I found surgical procedures operative. So this is the way in to the very long list, which I will show you in a second, of all the different surgical procedures. So if we click on this link here, we can see the section of the mesh tree that is surgical procedures. It is very long. And if we want to see the actual tree, this is just a segment of it. If we click on full tree here, we can actually get even more details. So everywhere there is a little plus sign means there are additional terms underneath the sort of home, that home mesh term. So if we scroll all the way down, we have neurosurgical procedures. But if we click the little plus sign, we can see there's lots of different types of neurosurgical procedures. No, I can get into more. It's a great question, Kevin. I'm happy to talk about that a bit more at the end, and I can show you a resource that might help with that, but broadly speaking, we can't do it simultaneously. Is there a mesh term guide library for each? I don't quite know what you mean, Mashid. Sorry. Could you explain a little bit more for me?
Hey, can you hear me?
I sure can. Thank you.
Yeah. I was curious about this and that you're showing to us. And I'm asking this question following Razan's question. Mm-hmm. For example, can we have we can go and search in ChatGPT the mesh terms with regard to the brain tumors, but you know what I mean? I wanted to go, for example, for glioblastoma, what are the mesh terms for the patient survival in adult population for the glioblastoma multiforme? Is there a guide that for search, what are the probable mesh terms that we should consider in during our search? Is there any guide for us somewhere?
So as a bit of a warning, ChatGPT makes up mesh terms. It will actually, it can give you some ideas. So it's fine just as a place to start. If you're needing to generate some ideas, you can grab those terms and put them into PubMed or into Medline and see what kind of comes up. I'm happy. I'll show you where there is a mesh term for, as I said, neurological neoplasms or brain neoplasms. Sorry, that's the mesh term. Basically, I would just, if you were interested in like glioblastoma, just put that term into that main search bar that I was searching in and see what comes up. if you can try ChatGPT. Again, it's a place to generate ideas, but I do not believe what it tells me though, because I have tried it on numerous occasions, and sometimes the mesh terms match up 100%. It will also make up mesh terms in the same way that it will, create phantom citations. I don't know why it does this, because it has access to the mesh, the full mesh basically index, this full tree that we're looking at. It has access to that through PubMed. PubMed is available for anybody to search. So I don't know why it makes up mesh terms. It really shouldn't, because it has access to this information, but it does. I've seen it do it on multiple occasions. It hasn't gotten better over these past few months. So you can try it to see what comes up, but just put those terms in. Yeah, so that's, does that help answer your question?
Yes.
Yes. Okay, fantastic.
So I wanted to add to Mashid's question. Is there some sort of centralized repository for the mesh terms? Is it such as some sort of browser, a mesh browser or something like that?
Yeah, so there's a few places. I mean, we can, if you would like to just sort of play around. So the list I've got here is the exact same thing. If we go to, let me just go to PubMed. If you click on the mesh database down here, and if we type in procedures, same, or actually, let's just do glioblastoma. This will give you the same results as if we do it. Sorry, let's try and get that out of the way a bit. That will be the same thing if we do it in here.
Okay.
So this is, these things match up 100%. So if this makes more sense for your brain, because this will give you some prompts, if we do brain tumor, it'll map to brain neoplasm. And I'll talk about what this all looks like in Medline in a bit. But this is, if this makes more sense for your brain for trying to find relevant mesh terms, that's fine. I would just then take these terms, and move them over into Medline for searching. Does that help clarify the question?
Yes.
Okay.
Yes, thank you.
Fantastic. These are great questions. Yeah, so jumping back, into Medline. So we've got our neurosurgical procedures. So this would be a case where, because we're interested in all of the neurosurgical procedures, I would explode this mesh term. So if we click here, I think I've got it. If we see here up at the top, there's our explode. So that's our explode button. Now, if we scroll back down, remember I talked about that scope note, that definition of the mesh term. So we always want to read this. So if we click the I, this is our scope note, and here. So neurosurgical procedures, surgery performed on nervous system or its parts. Okay, I mean, that's pretty generic. So that's why there are more, once we go down, that's why there are more specific types of what are these procedures. So if we wanted to read about, specifically, well, how are we defining craniotomy? Okay, that'll work. Fantastic. I'll talk about what this means in a sec. So in this case, I would explode this mesh term. This is just a fast way of saying I'm taking this. If I expanded this term, and just basically going all the way down and exploding everything underneath. You see how it's all tabbed in, sort of by one, everything under here. And then it goes back out to ophthalmologic surgical procedures. So this is synonymous with ORing everything in here. Does this make sense? Okay, it's just basically a shortcut. If you are interested in just one specific term, go with the most specific mesh term for the term that you're looking for. So because I'm interested in all neurosurgical procedures, I'm exploding this. That would not be, I'd say this is not common. It's not uncommon, but it's not normally how I would probably go with something more specific because it's based on your question. So from here, we're going to click on continue. And I'll explain this page in a little bit. So here we'll click continue. And here we've got our, so EXP stands for explode, neurosurgical procedures. And this little slash at the end means we've got, it's a mesh term. So that's basically the database syntax or the code for this term. Now, so we have the surgical procedures, but now we actually have to search for, and this is where this is unusual. Normally, you don't have to do this for other, in a lot of the other searches I do, I don't have to do this kind of additional step, but we also should search for, oh, well, let's throw in, so we want to search for the diseases as an example. So we already looked up brain neoplasms since we talked about that. So again, let's look at that full mesh tree. And so this shows us, it falls under different sections of the mesh tree. So it falls under central nervous system, brain diseases. I know this looks like it's central nervous system twice, like there's an error. It's not. It's because of how the mesh tree is organized. The further down you get, these will branch off in different places. But as you can see, everything underneath here is the same. So it's a question of, if your question is about, if you're interested in brain diseases, or are you interested in central nervous system cancers, depending on the perspective you want, you may want to look at that branch of the tree. I'm okay with central nervous system neoplasms. So we'll just click full tree just to see what's here. So here we're under diseases, neoplasms by site. So this is pretty common. So when I'm doing cancer searches, I spend a lot of time sort of looking around in here. So here we've got brain neoplasms and little plus signs beside. Oh, that is yep, that. So Marianne, I'm happy to talk about that at the end. That's a great resource, definitely. Yeah, so we can see here there's little plus signs, so we can add additional terms, but we'll take all brain neoplasms here and we'll click continue. Now here's where we can use, these are called subheadings. Now what subheadings do is they basically provide additional context for a mesh term. Now the subheading for you guys that is most relevant is probably going to be surgery. You may not need it, but it's basically contextualizing anything about brain neoplasms, but within a sort of surgical context. So when I'm doing my surgery searches, this is something I use quite a bit. There are other subheadings in here that you can use. But so as you think, if you think they're relevant, so maybe you're interested in brain neoplasms, but you're more interested in, imaging, you could use this one. Whatever you like, but I generally stick for at least surgical searching. I stick with surgery and we'll go continue. So if we want to see what this looks like, as we click on a record, so here's that sort of page again. Here we've got the type of neoplasm and there's the subheading, so the surgery. And we can see we've got a few different kinds of cancers in here as well, but within that surgical context. Now, the one last thing you need to, for mesh terms, welcome to the wonderful world of surgical searching, is you actually might need to approach the search also from the body part standpoint. So we've got the procedures, we've got the disease, if relevant. We also might need to come at it from, I don't know, well, let's try skull even, see how that works. So we have to come at it from It's not just, so we have the name specifically of the procedure, of the disease, and then of the body part. So these are the three approaches that you kind of have to approach the surgical, like the surgery concept. This is how you kind of have to build up your search. This is unusual in most other searching that I have to do. Like, I don't have to do this when I'm doing cancer, really. Like, if I'm just doing a straight cancer search, I don't have to approach cancer from this many perspectives. So welcome to the wonderful world of more advanced searching. So here we've got skull, and here we've got the different chunks. Okay, we can go to the full tree. Lots of plus signs under there. We can do that. So we'll explode it. We'll click continue, and we're going to grab surgery again, because again, we don't want just the skull. We want skull within a surgical context. And we might even do brain as one last one. Look at the full tree. I'm just going to hit explode. Continue. Surgery. So you can really build this up if you like. It can get kind of complicated. So those are just our mesh terms. Now we should really throw in some keywords. So when I did a quick, so we can do the keywords. So keywords again are found in the title and abstract. We can do neurosurge. If I do a star like that, does anybody know at the end, anybody want to tell me what that star does or the asterisk does?
That's wildcards.
That is a wild.
Come after that.
Awesome. Yep. So variant endings of a word. Just be careful when you're using it. If you do intern, so I do a lot of work with the residents, you know, well, internships, da-da-da-da-da. Why might this be a problem if I do intern?
Because internal medicine and all this stuff would
Exactly. Yeah. Yeah. We can get international internal medicine residents doing internships, which is a lot. Doing internships and if we do residency, often we might sometimes pick up residency. So residents as in you know, people in old folks' homes. So just being mindful of how variant endings can work. So we can do neurosurge. Now,
can we specify a range of letters after that, like in rectangular brackets?
You can. That function, though, is not translatable across all databases. So you can actually say, like, I'd have to check the what the code is for that, but you can say like truncate to like 10 letters or 3 letters. So that is possible. If you want the full, let me just pop open a new window. So I clicked on this I here. This is the database field guide. So if you want to, I mean, either you want to nap or to kind of play around with some stuff. This is basically all the shortcuts in the database. So if we go down, if we click on advanced searching, here we go, limited truncation. This is how you do limited truncation. So you do a question or a $, and then specify the numbers at the end. So if you wanted to intern $3, then you'd get, or 4, I guess, like then you'd get internship. But you could still get some weird stuff, and that function does not translate across all different databases, but it's there. Yep.
Thank you.
Yeah, it's a great question. So we can do neurosurge. We use our Boolean operator or. We don't have to put it in capitals. I'm just doing that so you remember that it's there. So or gets you more. We don't care how this idea of neurosurgery is going to be expressed. We just care that it's going to be expressed. Let me just grab. We also might want to do, and I know this might be a bit weird, because this database is incredibly literal. So what you put in is what you get out. So somebody might actually hyphenate neurosurgery. And so the hyphen is read as a space. So you don't need to worry about doing or neurosurge like that. You don't need to worry about that, but you should include, you know, if you think there might be a space in a word, you will want to include or a hyphen in a word, you'll want to include that. If you're thinking of sort of British spelling, so silent U's, silent A's, silent O for esophagus, found that one out. That was an interesting day. You'll want to include those as well, because this is a very literal database. If you do not search for it, it will not be retrieved. So what I did here, let me just go to my other screen and copy what I had for the whole search for this one, because it's kind of long. So what I did, there we are. So what I did was, so I've got general terms for neurosurgery, and then I also have the specific names of the procedures. And we can hit search here if we want. So it's ORing these all together. So it doesn't care whether it's in the title or the abstract or wherever, it's finding these terms. So this is called MP, or many places. We can also specify, so this is the default fields. So remember, title is a field, abstract is a field, author supplied keyword is a field. These are all the fields here, everything in these square brackets. These are all the fields that are being searched. We can actually change these fields if we want. So we can do, yoink, let me just grab this. So if we want to say, I want to just find these words in the title, you can put period TI. You want to do the abstract, you can go comma AB, comma KF, whoops, is the author supplied keyword. And we can hit search. And this will retrieve. See, we can see the difference in our numbers. So this brought it down quite considerably. So, yes, great question, Mashi. The titles and the abstracts have been translated into English, so we don't have to worry about searching for French content. We can just search in English. We're all okay there. We can talk about how to limit to a language later on, but you don't have to worry about translating anything. And to see your full search, you just click this little expand button here. So that's our sort of, I'd say, procedural term. So that kind of maps with this one. Now, the next line I did here was general sort of brain surgery. So this is going to be, so I'm going to use what's called an adjacency operator here. So let me just type this in and then I'll explain what it is. So I'm going to do brain or cranium or cranial ADJ. No, so that's called an adjacency. I'm going to put 3 and then I'm going to do surge or operation or procedure. TIABKF. Okay, so what is this doing? Yeah, so what this is saying is it's saying the word brain or cranium or cranial and all the variant endings has to be within 3 words of the word surgery or operation or procedure. So this way we can do brain tumor surgery, brain tumor operation, or so that's, and it also works the other way. So procedures to repair brain tumors, operation on cranial nerve. So it works right to left and left to right. And so basically, so it's saying brain surge, brain operation, brain procedure, cranium surge, cranium, that way. And it also goes procedure, brain, procedure, cranium, procedure, okay, so that's how this works. And then we're searching for it in the title, abstract, and author supplied keywords. So great question. If you want to search for different spellings of words, you actually have to spell them out explicitly. So let me just hit search and I'll show you very quickly what that might look like. It's a great question. So if we do the word color in the title, and if we do color in the title, these are not the same. We OR them together. See? So this is, you need to think of variant spellings of words. So pediatric, you're gonna have to do that. Tumor. So that's also kind of why I kind of, I use the adjacency to kind of avoid in some ways, maybe having to spell like tumor or tumor with or without the U. What other terms? Yeah, esophagus is one. There's a silent O in that one. Yeah. So check. I mean, I sometimes just do a quick Google search, like British spelling for, and just to make sure that I haven't missed anything. Yeah, good question. So we can just click remove. So you can just delete lines here and we'll click remove. And then my last, so I think that's pretty good for a, surgery concept. I mean, can you imagine? We've only just done our surgery concept. This is crazy. So what we can do is we'll select all of these. And for our Boolean operators, are we going to use and or an or? Do we think? How are we going to combine these all together? Why do you say and? Or does somebody have a different answer? You do want all of them, and this is where it gets confusing. If you want all of them, you use or, because or gets you more. I don't care if an article is being retrieved by a mesh term, by multiple mesh terms, or only by our keywords. Actually, sorry, let me delete line. Let me get rid of line 5 because we already have that. We've got it down here. So just remove line 5. So we want or gets you more. So we'll do that. And now we'll move on to our haptics one. So I'll just do this pretty quickly. So haptic, we'll do this. So it's haptic technology. The one thing I do want to show you here is under the scope note, it's always good to read these because anything in all capitals means it's another type of mesh term, means it's another mesh term that might be relevant. So haptic technology is definitely relevant, but we also will probably want the mesh term haptic interfaces. So what I would do is I would copy this and I would probably also look at this in the full tree because it's falling under a few different branches here. So here we can see it falls under virtual reality. And so these numbers here, these numbers represent how many articles in this database are tagged with the mesh term haptic technology. So this is not a big number. We can also see that this year of entry, this article or this mesh term was created just last year. Because it lives under a few different mesh trees, but mesh branches, but really the big one is sort of virtual reality. So let's look under the virtual reality tree. We'll click under full tree. So here we've got virtual reality and haptic technology. If you're interested just in the haptic stuff, you could just search for this, but I would keep in mind when I'm doing my search is that I might actually need to just include virtual reality and explode virtual reality. So it would be this or haptic technology. And then basically, not all virtual reality articles, not all articles that are tagged with the mesh term virtual reality are going to talk about haptics. But any article published before 2022 is going to be tagged with the mesh term virtual reality. So that's kind of how we need to go back in time. And that's why we use, the explode and situating our mesh terms within that larger hierarchical construct to see that sort of relationality to maybe we have to, especially for newer topics, we might have to go back in time and by using the broader mesh term. So in this case, I'm just going to go with haptic technology, but I'm going to keep in mind that, if I need to tweak my search, I might need to go and use virtual reality and read for the haptic technology in those articles. Because here, all of a sudden, we've got, almost 6,000 papers. So there's a big discrepancy here between these two numbers. So we'll just go with haptic technology. We'll click continue. No real subheadings that are relevant. And then we also had our other one, which was haptic interfaces. I'm just going to do this to speed things up. And we'll do one last haptic. ABKF. Let's put a star at the end of that. And there should be other terms that we use. So once I tidy this up, I'll include those terms in. Oops, sorry. And we'll OR those together. And then we'll do this, and we'll end them. And there's our final result. So we never worry about our numbers until we use our and. If this was, 7,000, then I'd be like, ooh, okay, where did my search go wrong? What did I or instead of and? Or maybe my search is too broad, so we maybe need to tweak something. So that's where we would, start thinking about our results and maybe changing our search. I'm just trying to think of, okay, 2 quick things. So since we're in here, to keep track of your search, use the share search history links. So you can copy the search history details. This will, let me just, yoink, give me a new slide here. Link. So that'll give you the full search. And then if you copy the link, let's put it there. It's not terribly helpful, but it will give you a link that will basically launch this version of the search. It'll give you a quick link to this version of the search. So that's a quick way of, rather than creating an account and all that stuff, this is a quick way of keeping track of your search. Now, if I made any changes to this search, I would copy the link again, because it's basically the link is tied to this version of the search. It's not tied to this session of the search. The one last thing I want to show you quickly is the Scopus information. So Scopus, like I said, is a big interdisciplinary database. Fastest way to get there is under our databases A to Z list. Now in here, I would keep this as a very simple search. So I would do haptic with a star, add a search field. So we've got our and here built in already. And then let's just do neuro. Let's do neurosurge. Let's at least be a bit more specific. So neurosurge. Keep it super, super generic. And we'll hit search. Now what we can do here, so I mean, there's already not tons, but we can click on this analyze results function. And what this does is from our search, it's going to retrieve these different, it's basically going to break down our search into different types of sort of boxes of information. So we can see here that, like in 2015, there were a lot of articles published about that had something to do with neurosurgery and haptics. So if we wanted to see those results, we could actually click on there. If we wanted to see who's most commonly writing about this topic based off of this search result, we can click here. And here are the authors, and we can click on their names. Open this one, open a new tab. And here's their page. We can look at their results. We go back to, whoops. There, oops. And the one last thing in here that might be relevant, if you're working on an area that's kind of new, and you want to see the breakdown about how different disciplines have played around with your topic, you can click on the document by subject area. So if you wanted to see the articles that are more engineering based, you could click on those. And then, so here are the articles that are more engineering focused that deal with haptics and neurosurgery. So there we go. Sorry, I know that was a very, very quick run through the Scopus results. Again, if that looks like something that is that might be useful to you as you're searching, play around with it. I swear you can't break it. I have tried on numerous occasions. But I thought it was a sort of, again, if you're just beginning a topic and just kind of want to get a flavor of what's out there, I find doing a really simple search and then clicking on that analyze results function is a nice way to give you sort of that that functionality. I know there was a question about mesh or the Yale Mesh Analyzer. I know I'm 1 minute over. So I don't want to, keep you guys from there, but I'm happy to stick around if need be. But I just wanted to just stop sharing. There we go. Just wanted to thank you all for coming. I hope that was helpful. Yeah, and I'm happy to meet with you as you need.
Thank you very much, Andrea.
You're welcome.
I see there have been a lot of questions.
Yeah, they were great questions. They were excellent questions.
Yes, so there's a question that was put in there. I think how it handles some, let's say if you have got different spellings of the same words.
Yep. Yeah, so we talked about that. Yeah. I mean, Yoav, do you want to go ahead? I mean, I also don't know if you guys have, if I need to relinquish the Zoom, I'm happy to stay. So it's entirely up to you guys.
Okay.
Yeah.
First of all, thank you very much for this bringing this topic. It's really important, and with the sea of data that we have, it's like really helpful to know how to search it correctly. I wonder if there is a way to order the results by certain factors. For me, it's important sometimes because, let's say I have 100 articles, I want to sort them by say citation, impact factor, something that will show me this article is more important, like scientifically than others, because I can't read 100 articles, obviously. So is there a way like...
So that's where Scopus is more useful. I'm happy to share my screen again, but it's basically, it would be taking, what you would do is you would take the keywords. Here, let me show you. It's much easier. That one. Sure. Yeah, so let me just go back to, let me reset this. So what you would do in Ovid is very powerful. It doesn't have great, you can sort by, it's not particularly useful, frankly. The reorganization in Ovid isn't great. So what I would do is I would take my keywords here. You can copy these. Don't use the TIABKF. That is unique to Medline. You can take that and let's reset this whole thing, really. Here, we'll do this. And we'll pop that all in there. And we'll do haptic again. And we'll search. See how many we come. I mean, it's only 40, but that's okay. But what you can do in here is you can sort by, so it's normally presented date newest. You can sort by relevance. With 40, it's kind of not the most useful, but that's okay. It will basically reorder these. It will reorder the 40. How that algorithm is basically weighted, I'm not sure. I'm sure it has to do with like where these terms appear in the title or the abstract and in relationship to each other. So there's a bit of that. I'm not quite sure, but at least, you know, it's this function, let's say in other databases or in like Google Scholar, will, if you do sort of a relevancy ranking, it will bring in other stuff, which is not helpful. Like at least this will just sort of reorder your search. You can also do cited by highest. Something else in here that's helpful that I didn't get to is using Scopus for citation mapping. So, you know, when you're searching, again, if you have an article that's relevant, you know, you found through Google Scholar or whatever, you know, your supervisor sends it to you, you can just pop it in here and say, okay, well, you know, you'll obviously look at their reference list, but okay, but since its publication, how many times has that article been cited? So if we in here, we can click, so this article has been cited, sorry, 178 times. We can click on this 178. It's a little big, but that's okay. And here are those 178 articles. So again, it's a way of using Scopus to sort of broaden your search without having to do a search. So again, at your initial stages of searching, this is a nice, or initial parts of your project, this is a nice little tool. And again, you can reorder this by cited highest, by the author, et cetera, et cetera. Does that help to sort of, you know, parse, you know, how do you take your information and parse it out in a bit more refined way? Does that help?
I think so. Yeah. Thank you very much.
Okay. Yeah. I mean, Scopus is pretty straightforward for using. I like Scopus because everything in here is basically clickable. So if we wanted to, you know, here's Dr. Del Maestro, fantastic. So we can click on, here's his author profile. This is not relevant. This isn't the right one. I know he's got more than this. Interesting. I wonder why. Anyway, so like this authors in here will have profiles. If it's more complete, there's sometimes a little bit of wonky stuff going on. As in this case, I know Dr. Del Maestro has definitely a higher H index than one. Yeah, just a little bit higher, just a little bit. Maybe I'll send him an email. And it's like, maybe we need to tweak this for you. Yeah, so we can, but this is a way, again, if you have an author that you like to follow, you can also set it up so that you know, every time they publish something, you can get an alert from them, stuff like that. So that's why I like Scopus. It's very clickable and sort of more easily, stuff is more easily discoverable in Scopus than it is in Ovid, but a lot of the advanced search functionality isn't really available. There are some other additional advanced search functions in here that I didn't get a chance to show you. I mean, I can now if you would like, or we can meet individually, whatever you like, but that don't translate into Scopus. So Scopus is bigger, Scopus is easier for exploring, but if you really want to start paring down your search, that's where I kind of take those ideas and again move them into Medline. Good question. And for the Yale Mesh Analyzer, that was an excellent question. So what the Yale Mesh Analyzer does, you can't actually use it for searching. Basically, what it does is if you have, again, a known article, what it will do is it will parse out the mesh terms for you based on the PubMed identifier. Sorry, let me just bring the chat. Yoink. Yep, okay. And Marzi, I see your question, so I'll show you in a second. So let me bring up the Yale Mesh Analyzer. So I'll include this in my slide. So here it is. I need PMID, so PubMed identifier. In here, something older. Sure, let's go with this. I need something with some mesh terms to show you this. So the UI number here, this is again a field. This UI is the same thing as the PMID. So I'm just going to copy this in and paste it. I'm going to include, I set it up so I can read the full title of the articles. I want to see the full name of the journals. I also want to see the abstract. and I'll just keep it as an HTML, but you can export this as an Excel file. And you can include multiple studies in here. If we click go, so here is the paper. So PMID, the title, here's and here are the mesh headings. So this article, here's the laminectomy. So that's the mesh term. That's one of our major mesh terms that we would be looking for. So the AL mesh analyzer is really helpful if you have a string, or if you have a series, or if you have multiple papers that are relevant. Again, let's say that you found through Google Scholar, through your supervisor, whomever, and you want to try and figure out, ooh, well, what mesh term should I be using? You can pop multiple ones in. Let me grab another one. Let's grab this one. Link, we'll go back. We'll put 2 in so you can see what this looks like. There we go. So here we've got 2 articles. So analgesic, how are we finding you? Interesting. Oh, probably has to do with this post-operative pain. I think this is why I'm finding it. Yeah, so you can look through some of the mesh terms and figure out why is it relevant, and which ones should you use, which ones are not relevant. So this is what the Yale Mesh Analyzer does. It's not actually going to do the search for you. You will have to already have basically a set of articles to test it against. And then let me just go back to my yeah, and for the other search functionalities, so if we click on this I here, this is the database field guide. I showed you it earlier, but if you click under advanced searching, you can see some of the advanced search functions. So I showed you the adjacency operator and sort of the defined adjacency operator. Something I also like to use is the frequency operator. So I can show you this pretty quickly. So what the frequency operator does is it says how many times does a word appear in basically the abstract, because basically if a word appears multiple times in the abstract, it should be more relevant. So you use this with words like, as an example, if you're searching for equity, diversity, and inclusion articles, and you're wanting to look for articles that talk about inclusion, well, inclusion in scientific papers basically appears in every abstract because it's either inclusion criteria or we included, X population. Like, it doesn't mean inclusion in that EDI context. So to use the inclusion term as an example, so what you would do, or the frequency operator, so you do inclusion, period, TI. So we just search for the word inclusion in the title. It's a little broad, but that's okay. And then we would do inclusion. So if you just wanted it to see what it looked like in the abstract, I mean, 331,000, that's very big. I am not looking for that much. So if we wanted to do the frequency operator, we do inclusion, period, AB, period, and then we'd hit a slash, FERQ equals, and let's say 3. You can put 2, you can put 10, you can put whatever number you like, and then we'll hit search. So that means the word inclusion has to appear at least 3 times in the abstract, and then you would basically OR that with your title. And that's how, I mean, it's still a big number, but at least it's not, 331,000, because that's far too big. Yeah, so that's the other frequency, the other sort of advanced search function that I think is particularly helpful, but you really only use it for words that I call them wibbly wobbly words that have multiple meanings and can be used in a variety of different ways. So you do need to be careful about using it, but it is a helpful one if you've got some of the, like if you just want to search for the word brain, depends on your other, depends on the other concept that you're searching, that you're searching for. So you could try it with brain, try it with surgery, but I mean, yeah, you can play around with it. You cannot break these databases. This is why searching is such an iterative process. You just kind of have to, especially when you're starting out, you just have to throw stuff at the database and see what sticks and refine as you go. And that's totally fine. That's absolutely part of the process. I think I answered all the questions there. Anybody have any other questions that they'd like me to cover?
So yeah, so thank you very much, Andrea.
You're welcome.
I think they know now where you are.
Yeah.
If they need help,
Yeah,
they'll come to you.
sounds
So thank
good.
you very much, and
Yeah, you're welcome.
everyone for attending the seminar. And good luck with your searches.
Absolutely. Yes, I'm happy to meet with you as you guys work through these things.
Yeah,
All
thank you.
right. Take care.
Take care. Bye.
Bye.